The Mayo Clinic is now celebrating the 100th year anniversary of the Mayo Clinic Proceedings. And this makes us really proud and excited. Historically, the Mayo Clinic Proceedings was an internal journal designed to educate the Mayo Clinic staff. And over the years, and under great leadership from our editorial board and editors, it has evolved to be really, truly a broad, outside the institution, national and international top medical journal. My name is Dr. Frederick Meyer, and I'm the Executive Dean of Education at Mayo Clinic and for the Mayo Clinic College of Medicine and Science. I'm also the Dean of the Mayo Clinic Alk School of Medicine and the Eline Professor of Neurological Surgery for Mayo Clinic. In this month's proceedings, myself with my brilliant colleague, Dr. Rafael Fonseca, have an article about how Mayo Clinic Proceedings was involved in advancing medical education, which is called Mayo Clinic Proceedings and Medical Education. Medical journals, as the partiture of medical knowledge, basically tries to emphasize how publications can advance educational sciences. Most of the articles in the proceedings are focused on medicine, in the broadest definition of medicine, and patient care. Mayo Clinic has 3 shields: the clinical shield, research shield, and the education shield. And the proceedings supports all 3 shields, all 3 endeavors of Mayo Clinic. And of course, research is directly connected at Mayo Clinic. Much of our research is clinical transitional research to advance patient care. And education at Mayo Clinic is designed specifically to produce the best next generation of healthcare workforce, from allied health to nursing to physicians to residents, etc. 50 years ago, 100% of the authors were internal Mayo Clinic physicians and scientists. Currently, only 25% of the authors are Mayo Clinic physicians, meaning 75% of the published articles come from physicians and scientists outside the Mayo Clinic. The Mayo Clinic Proceedings has a very high impact factor now, has a huge circulation. So for example, in 2024, up through August, we've had over 5 million readers, which is really quite remarkable. So when you think about that readership, the impact factor, the broad spectrum and depth of publications, it's a wonderful medical journal. Basically, it's designed as a medical journal to inform the general physician audience about the latest cutting-edge medical treatments. Some of that medicine is new innovations in surgical interventions. Some of it is really current state-of-the-art to provide updates in how best level evidence medicine should be applied. So we look for a broad spectrum in content. I would also point out that we now have 2 additional journals or companion journals, the Innovation in Quality and Outcome Journal, and now a Digital Health Journal. Within the contents of our journals, we have articles that are focused towards the learner, the resident, the medical student, the young faculty on staff, and also, of course, the most senior and seasoned physicians. That's the spectrum. We're trying to provide educational content that's going to be relevant across the spectrum of medical education. Again, all designed to advance healthcare and to provide the best in patient care and outcomes. Now, digital health was instituted within the last year and a half because nowadays, digital healthcare is becoming more important. Remote healthcare, digital monitoring, care at home. And we realized that this was really important for the physicians and for the healthcare, not just in the United States, but worldwide. So that's why we decided to create a companion journal. So these 3 together, the main journal, the Mayo Clinic Proceedings, the Innovation Quality Outcome Journal, and the Digital Health Journal, all as a compendium, are remarkable and effective communicators of the best, latest, and most advanced medicine. And we appreciate it. We appreciate that we have a broad readership. We appreciate that many of you contribute, and congratulations and thank you. And by the way, we encourage all of you to submit articles.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.